Hi, thank you for joining me. This is Dr. Erica, pharmacist for close to 10 years now. Thank you for joining on this particular video. I'm going to mention the law exam for pharmacy graduates who are interested in becoming licensed for the state of in the United States. So this particular MPJE again is a pharmacy law exam. It's comprised of local law as well as state law and then also federal law. It's a combination of the two on the exam, and the exam will consist of prescription labeling facts, also prescriber information on prescription, and controlled drug law as well. And it'll also consist of not only controlled drug law, but those specific details pertaining to the state and what each state individually requires for a pharmacist to be licensed. Okay, so I have a study book that I purchased for one particular state. I have a Florida pharmacy law book that I utilize before before becoming a pharmacist for the state of Florida. So just to give you some of the information in this book governs the pharmacy, the prescription itself, the label on the prescription, DEA registration, and also practitioner information. Now, there also will be information about the forms for ordering controlled medications, such as the 222 DEA form, the form for filling out in case there's a loss or tamper of medications. Also, it will consist of information such as what information should be reported and what information should not be reported. Things like that sort is what you're going to need to know about. Also permits for technicians and certification, also inventory and audits, what to look out for, what to actually be checking for, and also the ratio. You want to know the ratio of technicians to pharmacists as well for your state. And then also record keeping, prescription filing, and records to be maintained for so many amounts of years or months, depending on the particular state. Now, this particular book does have two exams at the end of the book. So once you go through this particular book, there's two additional exams post chapters that will allow you to go through and test your knowledge and your skill base, and it gives an answer key as well so that you'll have the correct answers. Okay, now it does cover abuse of controlled medications as well. The test does, and you'll see the information concerning the trilogy, the abuse and substance abuse, things like questions like that you'll see on the exam. Sterile compounding, which law is correct or which law is incorrect, things of that nature. So I'll read a couple of questions from the practice exam in this book for the state of Florida, okay? And okay, so one question says, how many days a week must a community pharmacy in Florida be open? Okay, each state is different, as we know, and it's specific for each state as to how many hours a pharmacy must be open for operation for customer and patients to come in to pick up prescription. Okay, and that number is A, 4, B, 5 hours or 5 days a week, I'm sorry. C, 6 days a week. D, 7 days a week. Or E, the law in Florida does not require a specific number of days that community pharmacies must be open. So the correct answer is E. The law in Florida does not require a specific number of days that community pharmacies must be open. Okay. I'll read one more question for you. A pharmacy compounds a medication for a physician. In which of the following activities may the physician engage? A, dispensing. B, selling. C, administering. D, selling the compound to another pharmacy. Or E, none of the above. The correct answer is administering the drug to a patient. So the physician, a pharmacy compounds a medication, and the physician is allowed to communicate with the pharmacist and be active in the process of administering the drug. Okay, so those are the type of questions that you will come across on the actual exam. And that particular question that I just read is a question that follows federal law. Okay, so the previous question about how many days a week must a community pharmacy in Florida be open, that is a Florida state specific law. And each, again, state has their own particular amount of hours per week to be open to the public. So do remember that as well. Okay, well, I hope that you find a great book of literature to help with your federal and state law studying. And please like, share, and subscribe. Leave comments as well, and I'll be happy to get back with you. These questions are very relevant and they're up to date. The pharmacy law does not change most often. It usually stays the same just because federal law has been around, it's been tested, and it has been set against the uh, general standard. So I would stick with one literature book. I wouldn't vary so much from one to another, and also study with a pupil or partner that you can work with and study with and go through these chapters kind of swiftly. And also, let's see what else is in here. Post-marketing surveillance, phase 4 surveillance. Pharmaceutical companies that successfully gain marketing approval for products are not exempt from further regulatory requirements. Okay, so that is federal information. Over-the-counter regulations. You must know operational standard law. Okay, for example, 1951, Durham and Humphrey amendments of the FDCA specify 3 criteria to justify prescription-only status. Prescription status versus OT status. These are federal laws that you must memorize for the exam. Okay. Also, let's see what else is in here. Orphan drugs, abbreviated new drug application processing. Those are good points to memorize and to know. Pharmaceuticals, the main responsibility for the regulation of pharmaceuticals and the pharmaceutical industry is the FDA. Its headquarters located where? In Maryland. These are all informational statutes that should be memorized when going in, okay? So the multi-prudence jurisdiction examination, or MPJE, is a 120 question computer-based exam that uses adaptive testing response questions. Okay. A passing scale score is 75, with the minimum score being 0 and maximum of 100. Some major points to remember. All questions are answered in order, so they're not going back. So there's no going back. Once you press that submit button of your answer, you must go to the next question. Okay, lots of situational questions, case-based questions. Online registration costs. You will need to bring 2 forms of ID. Okay, there's 120 questions, 100 counts towards your score, and must complete 1 of 7 questions for exam to be scored. Okay, if you do fail, you must wait 30 days to retake. Hopefully that won't be the case. And the exam does not distinguish between state and federal laws. You must answer each question based on state law. Okay, so that means the question for federal law may be more generalized for a question pertaining to your state that you're in. So answer each question based upon the state specific information itself. If the answer is more broad, that could be the wrong answer. So you want to answer specifically for your state law. Okay, any misconduct or inkling of misconduct is grounds for failure, it says. Arrive at least 30 minutes early. Ensure to read every single word. They will try to trick you, so make sure to answer the question they ask and look out for unusual words or triggers. Okay, NADP website for MPJE examination is also a good place to register for the exam and also to get more information about the scoring and so forth. Okay, so I am Dr. Erica, pharmacist for close to 10 years now, and I'm sharing with you some health information, pharmacy specific information, and I thank you for joining me. Okay, like, share, and subscribe. Hope this information has been very helpful, and I hope to see you on the next video. Take care. Bye-bye.